Crew's head was just different. I had never seen a baby with a head so pointy in the front and narrow in the back, and it just didn't sit right with me.
We were contacted by them at about 7 weeks of age. When the baby was born, the baby had what we call a cephalohematoma, and the head shape was very concerning for metopic synostosis.
We have 2 frontal bones, 2 parietal bones, 2 temporal bones, and an occipital bone. And where these bones come together, they're called sutures. And these sutures are the growth plates within the skull. When those bones grow together too early, it's called craniosynostosis, and the skull can't grow.
So we said, we're going to see the baby day after tomorrow because both Dr. Cools and I are here in the office.
Any parent who's told that their child might need brain surgery is very, very anxious. And so being able to see them the same day takes away a lot of that uncertainty.
When we came to Children's Hospital in Michigan for the first time, we were so impressed with how fast everything went.
And just the way they work with one another. We didn't have to see plastics and then wait and then go and make another appointment with neuro. It was like, hey, just head downstairs and they're waiting for you.
They said, this is what we're gonna do. This is how we're gonna go about it. It seemed like a walk in the park to them.
What we did for Crew, what's called an endoscopic strip craniectomy. And when kids come to us as early as Crew did, they have more pliable bones. We can do a less invasive surgery in which we just take a thin strip of bone around the fused suture and then place the kids in a helmet that allows their head to assume a normal shape over time. The pediatric neurosurgery program here at Children's Hospital of Michigan is uniquely positioned to take care of these kids because we have advanced practice providers, both within neurosurgery and within plastic surgery, that exclusively take care of kids and are used to dealing with the problems that kids might have.
When you're doing these rather sophisticated craniofacial surgeries, you need a pediatric neurosurgeon who is comfortable doing these. Not every neurosurgeon is. You need a craniofacial surgeon because the neurosurgeon is worried about the bone and the brain, but I'm now going to be worried about the shape and the appearance.
The surgery itself, I feel like I wasn't that anxious for because the doctors really did put us at ease. It was post-op that I had the hardest time with. He was just, I don't know, inconsolable. And as a mother, that was really hard for me. Felt like I didn't know what to do. So the nurses stepped in and they really helped. They cradled him, and at one point a nurse was singing to him, just really comforting him and providing, the care that I wanted my son to have.
It may get lost on them in the day-to-day that it's just a job, but it's not just a job to people like us. They come in here with our little baby and they provide excellent care. They're doing the Lord's work, and it's fantastic. They did a fantastic job.
We couldn't be happier with his progress. He's obviously very interactive. He's very, very strong.
This part of his forehead has, instead of being pointed, has flattened. The upper part is starting to round more.
Being the only pediatric hospital in the Metro Detroit area to perform these endoscopic strip craniectomies and minimally invasive surgery for craniosynostosis allows us to provide quality care for patients and their families.
Knowing that Children's Hospital is specific to children, we were very confident that the doctors knew exactly what to do.
We would recommend Children's to anyone. The doctors are so well educated, so personable, and they're wonderful with our baby. And that's the most important thing, is just the care for our child, and we found it here at Children's.